Hello friends, let us now learn some important previous year questions. So first, true about orbital rhabdomyosarcoma is. Orbital rhabdomyosarcoma arises from pluripotent mesenchymal cells. True. Orbital rhabdomyosarcoma arises from pluripotent mesenchymal cells. It does not arise from skeletal muscles. Orbital rhabdomyosarcoma, usually it is unilateral with male preponderance, that too less than 15 years of age. You will see in children less than 15 years of age. So it is more common in children, and orbital rhabdomyosarcoma arises from pluripotent mesenchymal cells. Next question. All are true about the treatment of age-related macular degeneration except treatment. So in age-related macular degeneration, we can use intravitreal anti-VEGF therapy, laser ablation can be done, photodynamic therapy can be done, transpupillary thermotherapy can be done. But prognosis after treatment for non-exudative variety is very good. This is false. Actually, it is not good prognosis. Prognosis is not good after non-exudative variety of age-related macular degeneration. Then next question. Causes of shallow anterior chamber is. Shallow or flat anterior chamber can occur due to whenever there is anterior subluxation of the lens. Yes, anterior chamber becomes shallow because lens has moved anteriorly. Pupillary block due to vitreous bulge after intracapsular cataract extraction. Whenever there is pupillary block, this will cause deepened anterior chamber. Okay, so this is not a shallow anterior chamber. Anterior dislocation of lens in the this is anterior chamber, pupillary block due to vitreous bulge. Yeah, here the problem here is, I will just draw a picture for this. Here there is pupillary block definitely, and this pupillary block is due to vitreous bulging. This is the vitreous cavity. Because the vitreous cavity is bulging, there is pupillary block. Then that is true. Here this is occurring, this pupillary block is occurring due to vitreous bulge. So obviously even here there is shallow anterior chamber. Anterior dislocation of lens in the anterior chamber. If the dislocation of lens is in the anterior chamber, then anterior chamber will be normal size. Subluxation and dislocation. Subluxation is it moves anteriorly like this. So because of that the anterior chamber will decrease. Dislocation is it will cut off here and it will dislocate. So because of the dislocation a little, the anterior chamber depth will be same. So it does not cause shallow anterior chamber. In turn it causes deep anterior chamber. Then aphakia. If lens are not there, then it leads to deep anterior chamber. Myopia also causes deep anterior chamber. So these are the causes of deep anterior chamber. Then true about pigmentary glaucoma. Pigmentary glaucoma is more common in females. No, it is actually more common in males with myopia. It is more common in young myopic males. Yes, it is more common in myopia. Then if you see here, you will see slit-like transillumination defects are seen in the mid-periphery. In pigment glaucoma, we see slit-like transilluminant defects are seen in the mid-periphery. True. Occur due to clogging up of trabecular meshwork. Yes, it occurs due to clogging up of trabecular meshwork. So these are the true points. Next question. Uveitis is seen as a common side effect for. Uveitis is seen as some common side effect of moxifloxacin, cidofovir and rifabutin. Uveitis is seen as maximum side effect for moxifloxacin, cidofovir and rifabutin. So these are the important points in ophthalmology. Thank you for watching.